Hello, lovely students. Miss Roselle, Miss Onquist, and the lovely Miss Reeves are videotaping us today. We are going to be performing an extraoral examination as an example for you. So, here we go. Let's do this.
This is your extraoral exam PE. You're going to start with the section of preparation. Notice Miss Roselle is wearing all her PPE. She's going to have removed the patient glasses, and she will obtain a periodontal probe, a barriered pen, and the patient's chart,
Which is invisibly
there. She's going to position the patient upright, have a light for use when needed for maximum visibility and illumination of the structures to be examined. She's going to communicate the procedure and the rationale for performing an extraoral examination to the patient.
Kelly, I'm going to be doing what is called an extraoral exam. I'm going to be feeling around the muscles and nodes around your head and neck area. If anything feels tender at all while I'm doing it, please let me know. And this is just to look for any abnormalities, okay?
Okay, thank you. She's going to, as you noticed, ask the patient to report any areas of tenderness during the palpation exam. Moving on to section B, general physical observations. She's going to observe the patient's general physical health, including posture, gait, physical and mental limitations, and overall appearance.
Gotta watch on that.
Visually, she's going to examine exposed skin to the head, the eyes, the nose, lips, and neck, and she will document and refer any abnormalities.
Yes, and as you're watching their gait and as their posture and their overall appearance, you can be doing that when you're walking your patient in. And then as you kind of put your bib on, you can kind of just be looking. And I noticed that Kelly has just generalized macules, freckles, but we call them macules. So I would note that, but none of them are raised, none are a different color, anything like that. You would also note at this time if they had anything that would set them apart. So if she had a piercing on her tragus, or maybe a nose ring or a lip ring or a tattoo in the head or neck area, you would note that in their chart at this point. So I'm just doing an overall look, especially if you have a man, maybe with a little bit of male pattern baldness. You're going to want to check back here for any moles or any suspicious areas there too.
Okay, moving on to part C, lymph node palpation.
Pause.